Welcome to Suchok Medical. So in this video we will talk about obstructive lung disease and restrictive lung disease. So in obstructive lung disease the main problem is the air cannot get out from lungs. The problem is with airflow out of lungs. Why this is happen? Due to airway narrowing and collapse or inflammation. Means if this is lungs, if the airway is too narrow, too short, so the air cannot come out easily. So this is the obstructive lung disease. But in restrictive lung disease, what happen? The main problem is the air cannot get into the lungs. Means there is a problem of lung expansion. So if this is lungs and this is the airway, so if the lung expands this much, then the air can get in easily. But if the problem lies in the lungs or in the chest wall and lungs expand just little this much, so there is no volume differences in external environment and internal environment, so the air cannot get in properly. So in restrictive lung disease the main problem is lung expansion is restricted, so can't fill lungs fully air. So this is the main problem. So let's watch again. In obstructive lung disease, the problem is with airflow out of the lungs due to the airway narrowing or collapse or inflammation. And in restrictive lung disease the lung expansion is restricted, so can't fill the lungs with full air. Now let's watch the obstructive lung disease in details. So in obstructive lung disease the main problem is air gets in but cannot get out easily, so air trapping is happening. As I said earlier, the lung, this is the lung and this is the airway. So if the airway is too narrow, this airway is too narrow, so the air cannot go out easily, so the air trapped here, so it is called air trapping. Now the test in spirometry, FEV1 forced expiratory volume in first second is low, so the FEV1 by FVC ratio is low. This is the hallmark of obstructive lung disease. But in restrictive lung disease this FVC1 by EV1 by FVC ratio is normal or increased. This is the difference. Now let's watch the obstructive lung disease more. In there is obstruction of airflow out, so the residual volume increase because the air cannot go out from the lungs easily, so the total lung capacity TLC increase. The main is RV, residual volume is increased due to the air trapping. So how can we memorize this? Obstruction means can't blow air out O, obstruction O, so cannot out in obstruction disease. Now let's watch the clinical features, which chronic cough, sputum, prolonged expiration. Why sputum? Because maybe there is excessive mucus production, so the airway fill with mucus, so airway's actual diameter becomes less. Prolonged expiration, use of, why prolonged expiration? Because the air is cannot go out easily, so body want to expire this air, so prolonged expiration. Use of accessory muscles to expire this air, and barrel chest. And classic tests are spirometry, chest x-ray, hyperinflated lungs, and DLCO is decreased in emphysema and normal asthma. So common disease in this are asthma, COPD, bronchiectasis and CF. Now in restrictive lung disease, as we said earlier, the FEV1 by FVC ratio is normal or slightly increased or more than 80%. And how can we memorize this? Restrictive means can get air in well. So clinical features: rapid shallow breathing, dry cough, hypoxia, inspiratory crackle and clubbing. Now classic tests are spirometry, chest x-ray, small lungs volume, HRCT test and DLCO decrease. And type and causes, intrinsic or extrinsic. Intrinsic means the lung parenchyma is affected and extrinsic means outside the lung. So the examples are there. And in summary table we can compare these two, obstructive and lung restrictive. You can watch here the summary table. So please share and subscribe for more medical knowledge. Thank you.